My name is Travis Alexander. I'm a postdoctoral fellow in medical humanities at Rice University. I work on the Translational Humanities for Public Health project, directed by Kirsten Auster. I'm joined here by my colleague Alikia Garam, who's an undergrad at Rice, and Sari Altschuler, who is a medical humanist. And we wanted to talk to you a little bit about the issue of American literature that you recently co-edited, what you were hoping to achieve with it, who your audiences are, and what you see the special issue as accomplishing. So with that said, Alikia is going to ask you a little bit about your background.
So can you tell us a little bit about your background and how and your education and how it led you to explore this project and the particular topic of literature intersecting with COVID?
Yeah, so, to go way back as an undergraduate, I think like most people who are interested in health humanities, I thought I was going to be a doctor. So I spent 2 summers working at Mount Sinai Hospital in New York, and discovered very quickly that probably wasn't in the cards, but I ended up as an English and biology major. And I remember at the time, and I think this really dates me about 20 years ago, my biology advisor said, I have no idea what these things have to do with one another. Really, I don't understand why you don't just pick a major and pick a career. And at the time, I was very convinced that they really were. I don't think I could have articulated it this way at the time, but 2 different ways of thinking about similar problems. I think now I would say they have different ways of knowing the world, or what we in the academy might call different kind of epistemologies or orientations toward questions. And so, then I took some time off, went back to grad school, and decided I really wanted to think a little bit more about those questions, questions that turned into kind of inquiry into the intersection between literature and medicine, and then health and the humanities more broadly. And then I graduated, and I think I've been out about 10 years, and I got really interested in health humanities, and it really was a thing that was really took off, I think, around 2008, 2010. The programs have existed since the 1970s, but in the last 10 years especially, it's become really a burgeoning field for a lot of reasons that I'm happy to talk about, including the sort of 100-year anniversary of the invention of the kind of medical education that exists now. And at that 100-year anniversary, people sort of turning back and reevaluating and wondering if things might be done differently. So I got interested in that project, and I ended up at Emory, where I was involved in helping to think about what the intersection of health and humanities looked like there. And now at Northeastern, I founded our Health, Humanities, and Society program. So I've been involved in these projects in a variety of ways for about, I guess, thinking about them for 20 years, but really working on them for about 10.
So can you tell us a little bit about the shape of this issue of American literature that you co-edited with Priscilla, who I will, full disclosure, was an advisor of mine.
Oh, fantastic!
And where I have published as well. So I have a stake in it. But yeah, if you could tell us some of the contributors who submitted work, and then maybe if you want to pivot towards the back end of that answer to thinking more globally about what you think an established academic journal like American Literature has to say, like what its role is in either diagnosing emergent cultural trends or possibly even correcting them.
Yeah.
In other words, why choose that vehicle in order to convene these voices?
Yeah, so I feel like I kind of want to answer your question, 10 different ways at once. So I'll do my best to think a little bit about it. I mean, the short answer is that the issue appeared in December 2020, which, as you might imagine, means that we actually got the contributions. We started the work in March 2020. The contributions were written in April. The last ones came in May of 2020. It really required a very quick turnaround. So the issue really is, in a lot of ways, about a really pressing crisis. Suddenly, suddenly we were in the middle of a pandemic. Very few people really had realized before March 2020 that that was going to happen. And so in some ways I wanted, I approached Priscilla about it because I thought I wanted to think through a variety of questions that seemed suddenly really pressing and that hadn't occurred to people for a long time. I think, and by that I mean, as someone who studies pandemics in the past, I had thought about these kinds of questions in the 19th century, but I hadn't. I think we hadn't really imagined that we would live them in the same way as we have been in the 21st century. And so that was the kind of impetus behind the issue. At the time, I was acutely aware, which is part of what our own entry in the issue pandemic reading is about the kind of limitations of attempting to know anything when you're really at the beginning of it, or even when you're in the middle of it. But I also thought that that was a kind of a perfect opportunity to begin trying to think through what it's like to think about something in the middle, and not to wait till we have an end to begin to make sense of things. I think sometimes that really forecloses ways of knowing particular kinds of problems. I think right now, for example, even though things are still unsettled, we know a lot more and we have stories that are already established that in March and April of 2020 we just didn't have. And I think that's very comforting in certain ways, even if depressing. But in other ways, it really forecloses the kind of proliferation and experimentation and variety of ways of knowing things that really was possible when people were suddenly thrust into this new situation. And so in part, I thought what would be interesting, and I think what comes out of what you can see in the forum is that kind of grasping for new ways of thinking about things, or how to sort of repurpose ways that people have been thinking about other kinds of problems into thinking about this newly pressing issue of COVID. So that was the kind of impetus behind it. Why American literature? It's the foremost journal in the field, but I also think, and Priscilla's work is really an inspiration in this way. She's done such a good job of thinking about how cultural narrative works and how we as literary critics really can offer a set of resources for thinking about what kinds of stories people tell about events like the COVID-19 crisis, how those events then shape not just sort of public life and cultural discourse, but what happens in public health, what happens in global health, and how we imagine solutions. And in her words, as she says is in Contagious, who lives and who dies. And so I do think that there are very pressing public answers that we can provide as literary critics. And I was hoping in part that the issue would begin to do some of that work. And I think Kirsten Auster's contribution in the issue does a really good job of thinking through, for example, the visual iconography of COVID and what kind of work it does. The other, I think, all of the contributions are really wonderful. One of the other ones that to me, or I guess I'll say two of the other ones that really struck me as surprising and extremely illuminating were Robert Peckham's entry on the chronopolitics of COVID, thinking a bit about COVID in a transnational sense, but also, what are the different narratives that are emerging and that can emerge in a place like Hong Kong as opposed to the US. And the other entry that I found just so humbling, honestly, is Jennifer James' piece, which opens the forum, which when I read it, she submitted in early May. I think now, when you look back at everything that happened, with George Floyd and the emergent discourse about twin pandemics, or this one pandemic that has two iterations, that both of which stem from racial and structural violence. I think all of that kind of stuff is now very obvious to us, like, oh, right, of course there were racial dimensions. I have to say, when I got Jennifer James' piece in early May, that's not how people were talking about things, and it's not how people were thinking about things. And her piece on dread really talks about the lack of surprise for the African American population in the United States, that once again there was going to be this devastating crisis, and once again Black Americans were going to be disproportionately affected, and that in a sense there was a really a recursive element to this story, that goes all the way back to slavery. And I thought, oh, I felt at the time very humbled, right? I thought, oh, this isn't the way that white Americans are talking about the pandemic, as novel, as unprecedented, trying to make sense of things, reaching way back, to Defoe to try to make sense of things. And in her piece, she says, no, Katrina was this. There are any number of crises in recent American history that we can look back at that feel the same. And so, yeah, I just thought that was such an illuminating way of thinking about the kind of narrative forms that we use to try to make sense of the pandemic.
One thing I'm gleaning from what you say there, which is not a surprise to me, but maybe to a lot of our readers and listeners, is that a lot of those essays you just talked about have nothing to do with literary objects, right? Yeah. They're analyses of visual culture, of legal precedent, of ecological disaster, et cetera. And I wonder if you could just speak a little bit about how you conceptualize the purchase or power of a training in literary study and literary methods of reading that have kind of domains outside the familiar ones of novels and poetry, right? Like, yeah. How does that education prepare you to do a much more robust and broad cultural study?
Yeah, I mean, I think, those of us who work in this field still write about Melville, but for sure. but that kind of training, thinking about genre, thinking about metaphor, thinking about literary tropes and devices, that kind of training, what it does, I think, is it trains you to see how things are built. It trains you to see that, the way that we understand the world is really shaped by the kinds of stories that we tell about it. And there's no outside of that. I think sometimes when people think about, for example, empirically based science or empirically based medicine, there's an imagination that exists outside of stories, but it doesn't. That empiricism is itself a kind of story. And so, and it tells a kind of story about, what kinds of evidence count and how we make sense of the world. And what we do as literary critics is really to look at those kinds of containers and say, okay, this is the kind of container that we have. This is the narrative. And it has these features, right? It has these characters. It has these kinds of metaphors. It has these kinds of plots. And those devices actually allow you to tell certain kinds of stories and don't allow you to tell other kinds of stories. And that can be, that's not a criticism. That's just the way that we make sense of the world. And so once you begin to realize that the kind of training that people in literary studies have to think about how form works, how language works, how powerful that is to unmask things that seem like common sense, to unmask the kinds of the ways that people talk and think about the world, then suddenly I think we have a lot to contribute in terms of allowing people to see, the tremendous movement forward that facilitates from science and medicine, and also and Priscilla's work does this, I think, so wonderfully, and also the ways in which some of those stories and some of the narrative forms are really racially encoded. They really are kind of structurally racist, structurally xenophobic. That's especially true about global health narratives. And so thinking, sort of unmasking the narrative form that people use to think about these kinds of crises like COVID-19 allows you to begin to think differently about them. If you say, for example, in my own work, I've thought a lot about the kind of Gothic origins of global health. If you say this is how the Gothic works, and certainly people have used the Gothic to kind of write back against its xenophobic and racist elements, but it is kind of structurally racist and xenophobic. If you begin to sort of say that, then you can say, okay, what do we want to do, and what are our stories occluding?
I've always been certain myself that literary scholars like us are experts at everything, and I'm glad to hear you confirm that.
I actually, I wouldn't say that. I'm just going to take a step back because I realize it does sound, what I said sounds a little bit hubristic.
Not to me.
As somebody who works in an really interdisciplinary way, I'm extremely humbled by what I don't know. And I think, we do really, this is about saying, what I can tell you about is how stories work and how to look for genre, how to look for form, how to look for literary devices. There's lots that I can't tell you about. And there are many, many other disciplines that are extremely smart at telling you about how to think about the world from those perspectives. I just think that we deserve an equal seat at the table with the social scientists and the natural scientists and the doctors.
I'm teaching a class right now on the cultural history of immunity, and come out on day one and say, at no point in this class will I tell you a single thing about the immune system.
Exactly. Yeah, and it's wonderful to work with people who can tell you those things.
Yeah. I think Alikia had a question about comparisons between different pandemics, if you wanted to ask that.
Yeah, so this is like a more specific question, but have you seen parallels between the cholera pandemic and the COVID-19 pandemic, especially regarding their effects on the African American population, especially through your study of literature and any other past pandemics you've studied in general?
Yeah, so I've thought a lot about this in part because in my first book I write quite a bit about cholera, and I was really interested in the cholera pandemics. I think as a kind of under-acknowledged, a really sort of like under-acknowledged undercurrent of the 19th century. These pandemics didn't go away. They come much like COVID-19. They come out of an Asiatic space. It was actually called the Asiatic cholera in the time in which we still use pretty racist terms to think about the origins of disease. And so it comes out of India and makes its way across. And I think much like the COVID-19 pandemic, people in the United States are tracking it, but they just don't think it's ever going to really arrive. Or if it arrives, they think it will be contained. And so there's a lot of writing in the early 1830, 1831, sort of lamenting how bad cholera appears to be in Russia and then in Europe. And that really parallels, I think, the ways that we were kind of looking at things in February 2020 in Italy, in Iran. And then it arrives in the United States, and it's quite devastating, and it's very shocking. And what had seemed like a sort of interesting intellectual question, or a question that people were interested in the news, is suddenly very real and killing people quite spectacularly. And cholera is much more, not anymore, because now we have ways of treating it so that people don't die if they get treatment. But at the time, they didn't really know what it was. I think in that way, it also really parallels COVID. This sense that you kind of think you know what this thing is, but then it has all of these surprising symptoms and surprising elements, and you're always kind of learning that you were wrong. Okay, it's not a respiratory, I mean, in the case of COVID, it's not a respiratory disease. Maybe it's a blood disease. Maybe certain kinds of people are more prone to getting it. Maybe other people are more prone. You really, doctors really were quite caught off guard as well by cholera, and the effect was pretty spectacular in the 19th century. It really, the medical profession in the United States took a huge blow, and also in Europe, because of cholera, because of how little they knew about it and how little they were equipped to actually stop people from dying. Cholera will kill you very, very fast, and it had these very spectacular symptoms. Their skin would turn blue. They were vomiting and defecating themselves to death. It's awful. It's just a terrible way to die. And so I think like the COVID-19 pandemic, it really it had a number of effects that were very similar, just in terms of the sort of uncertainty initial uncertainty that it really prompted in lay people, in physicians. And then I think, and this is something I got really interested in, the kind of um, crisis of knowing how the sort of routines of medical care were really upended by cholera, how they had to think about, and Charles Rosenberg is really, if you're looking for the text about this, it's Charles Rosenberg's The Cholera Years, which is actually uh, more than 50 years old now, but still really the text to go read about it. And it just really completely revolutionized medicine. I think you saw certain of the same characteristics happening, happening as COVID-19 unfolded. Namely, I mean, I think most surprisingly to me was the kind of improvisation that was happening in hospitals, trying to think about how to use, for example, the sort of those pregnancy pillow devices to help people breathe better. The ventilators are good, the ventilators are maybe not so good. There's a lot of experimentation happening, which I think is quite similar and very, I'm not saying, I think actually medical research is hugely creative, so I don't actually mean to suggest that it's not, but I think it's not usually unblack boxed for us like that. And the other element that I think it was been so interesting is thinking about how medical research, the ways that we credit medical research really shifted quite a bit. People started looking at medical research before it had been peer reviewed. And that, that seems like a big no-no in medicine in general. But people really wanted answers because they had huge numbers of people who were dying in front of them. And I think in that way, it really resembles cholera. And I think the last thing that I'll say about it is just about the kind of, although I'm happy to talk about the narratives and the ways in which the cholera narratives have been reemerging, because certainly like Mask of the Red Death, which is a story about cholera. I know it's about the Red Death, but it's a story about cholera. And people have been using that as a touchstone for COVID as well. I mean, but the last thing that I wanted to say was just about the kind of temporality of, which is to say like, how time feels, how it works, how we imagine it, how we talk about it in a pandemic is just really different. And I think we've seen that again. I think the thing about COVID and cholera both was that they had this unending sense about them. It's going to ebb and flow, but when it's actually going to end is really unclear. And also the immediacy is really unclear. The temporality is really weird. If you yourself have been exposed, right? Suddenly your whole sense of time changes and you're looking to see, you're suddenly on a 5-day clock. Are the symptoms going to emerge? Am I going to get a positive test? What do these 2 weeks mean? Versus the kind of like elasticity of pandemic time otherwise, where it has these like ways in which you feel like you're always going back to the same day as this sort of Groundhog Day as touchstone for the pandemic that emerged in March and April of 2020. It just has this non-linear, I guess it's just non-linear time, and that has very different dimensions depending on where you are in the pandemic. I didn't answer your question about Black experience, but it is also true in cholera. That cholera also disproportionately affected the Black community. But I think, like Jennifer James's piece, the understanding of what cholera was, what it could mean for Black Americans was quite different than it was for white Americans, and it's worth preserving and really interrogating those differences.
Alika, anything else you wanted to ask?
No, that answered my question. Thank you so much for elaborating.
Yeah, thanks for coming by. Is there anything you'd like to alert people to that you're working on now and to keep an eye out for?
Oh, I have actually an essay that's supposed to come out in the fall that's about pandemic narratives. So in the journal Resilience, if you're interested, and I wrote it at the same time. So it will be very much about 2020 narratives, but I was really interested in thinking about the different ways that people were trying to make sense of the pandemic narratively. What were the different, competing, contesting narratives that people were searching for at that time? And I hope, I hope we get past this, but I also hope that people can preserve this sense of uncertainty, what it's like to be in a kind of unfinished moment. Because I think I guess what I would say just to conclude is that too often we try to explain everything by reaching for the end. Oh, the end makes sense of everything that came before. But actually, I think what's more interesting is that in the middle, there are a variety of ways of thinking about things, and we can use those as resources to really imagine things differently going forward, especially because this isn't the last pandemic that we're going to experience if epidemiologists are right. So hopefully we can learn more from that space of uncertainty and unfinishedness. But thank you so much for having me.
Yeah, thanks for coming by. Go check out the issue of American Literature and look out for the new piece in Resilience. We will see you guys for our next interview.